So the Zika virus was discovered in 1947 in a species of rhesus monkey in a forest called Zika forest in Uganda. And in 2015, that's when we started to see it in the Americas with the outbreaks that we're hearing the reports of now. And in 2016, it's now confirmed in 28 countries. So Zika is usually asymptomatic, so most people will feel absolutely fine. They won't know that they've had the virus. For the people who do have symptoms, it causes conjunctivitis, pink eye, joint pain, fever, a rash, so nothing terribly serious. However, where the concern has really sprung up is that in Brazil, what they saw was an apparent increase in cases of microcephaly. So this is when a baby's head develops unusually smallly, and this can be associated with various defects. However, it's not clear whether the Zika virus is causing this increase, and there's a couple of reasons for this. One is that it's quite hard to link the cases of microcephaly with Zika virus, and that's because obviously people may not have known they were infected when they were pregnant. There is another issue that's causing a lot of debate, and what that is that until 2015 it was not mandatory to report microcephaly in Brazil, and it was only in 2015 that these new regulations came in. Also, there's been debate about what was considered microcephaly. So the original estimates were talking about a baby's head that was 33 centimetres, and then that's been adjusted to 32 centimetres. And that might not sound like a lot, but it is when you're talking about microcephaly. So they think that some of the cases might not actually have been microcephaly, and they're still going back and they're confirming some of those cases. So I think there's a lot of research still to be done. The Zika virus is spread by the bite of a mosquito. So just be aware that it's not all mosquitoes. So there's around 2,500 strains of mosquito. Only the females bite, and it's only one strain that's been linked. The other thing that it might be possible to catch Zika is through sexual transmission. So there have been about 3 cases so far where there is no evidence of travel or mosquito bite, and it seems likely that the virus was sexually transmitted. If you're in an area where Zika is being transmitted, or your partner has been traveling in an area where Zika is transmitted, then you should use condoms. And if you are in an area where you suspect Zika is being transmitted, then the simplest thing is to avoid being bitten by a mosquito. So wear long clothes, use mosquito repellent. The other thing you should do is you should look at any areas where the mosquito can hatch and maintain its larvae. So it likes areas with standing water. So it's been really linked. This particular species of mosquito has been linked to tyres because it really likes kind of nesting, as it were, in tyres with water in them. And that's one of the ways that it's thought perhaps to have spread across the globe in the way that it has. So do look at standing water. So things like your bird bath or small pools won't be so good for the mosquito.